It's hard for me to It is. Thank you. Thank you guys so much for having us today at Hispanic Tampa. I'm Katie Wyatt Reynolds, and I've been coming to Catholic on Tampa for all 15 years, here and there, when I have time, or when I want to wake up early. Today, we're here to introduce Tampa, really, to our Chief Medical Officer, Gwen Nichols. She's come in from New York to speak to us today. It's a really big deal. We're very excited to have her. The Leukemia Lymphoma Society is a national nonprofit organization with regions all over the country. The North Florida region, can you tell we were named by New Yorkers? Is Sarasota and Naples, Orlando, Jacksonville, and Tallahassee. So that is the area that we cover. My executive director and wonderful boss, Melanie Johnson, is right here in the front. And we are here in Tampa kind of leading the charge for the whole state except for South Florida. So if anything piques your interest, I think most of you know how to find me. And let me know if I can provide any more commentary or help after Ms. Nichols is done, or Dr. Nichols. So without further ado, Leukemia Lymphoma Society Chief Medical Officer, Dr. Gwen Nichols.
Thank you everyone for the opportunity to get to tell you a little bit about Leukemia Lymphoma Society, and also to spend some time helping us connect with other community leaders and community organizations, which is our goal. So I want to start with the problem with our name, which is the Leukemia Lymphoma Society only begins to tell you what we're all about, and not very well, I'm afraid. We started over 70 years ago, started by a family who lost their 16-year-old son to leukemia. And at that period of time, there were no treatments, and leukemia was a death sentence. And we heard this morning about several children where this is not a death sentence, and they are going to live to be healthy, productive adults. The goal of starting our society then was trying to bring the right treatments to patients, help with research to find better treatments and eventually cures, and to help patients in need. Over those 70 years, we have expanded from a small mom-and-pop organization to the second largest cancer organization in the United States. We also have a North American footprint because we have a sister organization, the Leukemia Lymphoma Society of Canada. All that to say, leukemia and lymphoma is only part of blood cancer. And so I thought I might start by telling you a little bit about blood cancer, because everyone knows someone who has a breast cancer, unfortunately, or colon cancer, or lung cancer, because it's much more easily definable. The blood cancers, they are cancers that originate in the blood cells and the blood-forming cells, which means the bone marrow, the lymph nodes. It's a very diffuse system because our blood circulates everywhere. And so it's harder to define than lungs or colon. But it includes leukemia, lymphoma, multiple myeloma, myelodysplastic syndromes, myeloproliferative diseases, and really a whole host of other comparable cancers that involve the blood system. And so our name doesn't help people find us when they need us. That's why I love to speak in community groups, because I think word of mouth and understanding who needs help is the biggest thing we as an organization need And let me tell you a little bit about the kind of help, and then I want to dig into what we're doing in your region. So in academia, where I spent a lot of my career, the Leukemia Lymphoma Society is known for the millions of dollars of research grants that they give to wonderful hospitals, including hospitals in Tampa like Moffitt. We have many researchers in the blood cancers that we support there. That is not the only thing that LLS does. And I think a lot of people, because it's so important, it is our road to therapies and cures, that's really important. But we have amazing services for patients. We have educational materials, paper, blogs, videos, whatever way people need the information, we have it. And we have it in English and in Spanish. And in Canada, we have it in French. So we have everything that people in North America can use. We also have information specialists, the 1-800 number where people, caregivers, patients, relatives of people who have cancer can call us and speak to a health professional, a social worker, a nurse, and people who have really specific information about blood cancers. And the way people know about this is generally searching on the internet. But it would be much more helpful if people in the communities where we're located help people find us. Say, I think all of us think, as I said, know someone who's had breast cancer. But you also do know someone who's had lymphoma, someone who's had Hodgkin's disease. We've all heard right now about families who have had acute leukemia. We need your help in getting the word out about how much we have to help people with local financial assistance, with lobbying for people to get the drugs that they need. You heard Laura talking about drug shortages. We get calls about that all the time. We can help, but we can't help if people don't find us. So that's my first plea to all of you, to please, if you know someone, and that doesn't mean necessarily someone who's in active treatment. We have one-on-one support. We have support groups that we can help people find. We have people, say a young person has lymphoma, and the only other people they see in their doctor's office are my age. They want to talk to someone like them who's going through the same things they're going through. We can hook people up to talk across the country. We have that kind of reach, and so we want people to take advantage of all that we have to offer beyond the research grants. The thing I want to tell all of you is about what we do for trying to get greater community outreach in underserved communities. So we all know that it is easier to find these resources if you have internet access, if you have a lot of family members that are helping you, if you have an education level that allows you to understand what's written in those resources. There are underserved communities in beautiful places like Tampa, and there certainly are in New York, and there certainly are in almost every part of our country. And one of the greatest needs is for people where English is not their first language. And so we are really beefing up our bilingual outreach. And I'm happy to tell you that we are in the process right now of hiring a community outreach manager in Tampa and one in Orlando. And they must be bilingual. And so we are really looking, because let me tell you about what patient and community outreach managers do. I think that's really important. They bring the LLS resources that I've been talking about to local healthcare organizations, to local health promotion partners. That's why I was fascinated to hear that we have a pharmacist in our midst, because that's exactly what we need. We need to find people who interact in the community, who are trusted resources, because we're the big, you already heard the New Yorker jokes, right? Okay, we're the big national organization. It's really important to find local partners, and in this case, promotores de salud, other Hispanic health organizations that can help us with what's the right way to approach the people who need our help, and to help them understand that this is all free, that this is not the government, this is not a negative but a positive. This is not people who want to exploit the population in any way. And I think we look for communities and community leaders like yourselves to help us find who are the people, who are the organizations. We have a lot of social media in Espanol. We do Facebook Live, all in Spanish. We have lots and lots of both print and people resources to provide. But we need to give those resources in a way that people find them, and that they that are sensitively given to people who may not trust the medical industrial complex. And so I think, I'm hoping that this community here can tell us, as we hire this new person, who should we be connecting with? Who are the people who are doing health outreach in your community? How can we bring more resources, not just for all of us, very importantly, who have internet and who are able to negotiate the system, but for the people who really are having trouble negotiating the system? And how do we bring that, and who do we work with, so that we can share what we're desperate to share, that we fundraise and build this so that we can help people, but we need a helping hand in the community. And I'm very hopeful that our conversation here can help jumpstart for this new person who's coming into Tampa, to bring all the great resources that those of us who are fortunate enough to be insured and have a college education and an internet access have a way of finding, and others don't. So I'm going to stop there because I'm happy to have a conversation about this. That's